Hello everyone, my name is Yanet Bonet Gongora, and I will be speaking with you today about my Doctor of Nursing Practice Quality Improvement Project entitled Nursing Education on Mindfulness-Based Meditation to Reduce Stress in Home Health Nurses. Before I begin my presentation, I first want to take a moment to thank Dr. Moyer, who served as the chair for my project. Without her support and guidance, it would not have been possible for me to complete this project. As noted on the title slide to this presentation, the problem that was investigated for this project involved reducing stress in home health nurses. Stress in the nursing profession in general has been known to be an issue of concern that can impact both the physical and mental health of the nurse. In home health nursing, the nature of the job has been associated with an increased stress for nurses, which could adversely impact nurse and patient health. Although stress amount in nurses is a common factor, there are steps that can be taken to reduce the stress, including mindfulness-based intervention. This is the foundation upon which the DNP Quality Improvement Project was undertaken. Included in this presentation is an overview of the project aims and purpose, including the PICO question, a review of the literature, an overview of the methodology employed, the project results, and a discussion of the results and what they mean for an advanced practice nursing and patient care. Purpose and PICO question. The purpose of this DNP scholarly project was to reduce the level of perceived stress experienced by registered nurses working in a home health agency through the use of a mindfulness-based intervention. The PICO clinical question posed to guide this project as follows. Among registered nurses working in a home health agency, that's the P, does the use of mindfulness-based training provided remotely, I, compared with non-education at baseline, C, result in a reduction in stress levels as measured by the perceived stress scale, O, 4 weeks following education, that would be our T. The significance of the project to nursing practice was twofold. First, the project aimed to improve the mental health of nurses who, in turn, provide the care of the patient. As previously known, stress can have a deleterious impact on the health of nurses, which can impact the ability of the nurse to deliver a high quality of care. Reducing stress level for nurses should directly improve the health of the nurse, while also having a systemic impact on patient health and outcomes. The second area of significance for the project for nursing practice was with regard to elevation of a standard of practice for all nurses. The profession of nursing continues to move toward an evidence-based foundation for care delivery. The implementation of this project should serve to contribute to an environment in which evidence-based care is the standard use of care delivery. Literature review. On the following slide, information regarding the literature review developed for this project is included, along with a review of the theoretical framework selected. So, search history. To support this project, a review of literature was needed to provide the evidence needed for translation and implementation. The search for literature began with identification of 5 electronic article databases. Search terms for locating articles on topic were identified based on the elements of the PICO questions combined with the Boolean operators. Article flow within the literature review is also included on this slide. As you can see, the search began with 532 articles and a total of 10 were included in the final literature review. So here, all included articles demonstrated a positive and significant impact for mindfulness-based intervention to reduce stress among nurses. 3 additional themes were also identified and are reviewed on this slide. The first theme was that many of the articles included outcomes other than stress that reinforce the benefits of mindfulness intervention. Most commonly, scholars note that physiological symptoms related to depression, anxiety, were improved as a result of the intervention, as well as resilience, coping, and self-confidence. Critique of evidence. A strength of the evidence esteemed for consistent results demonstrating that mindfulness-based intervention can reduce stress, as well as the high quality of evidence. All studies use quantitative methodology to demonstrate statistical significance. Weakness of the study also included that Many samples were randomized, were recruited voluntarily, limiting generalizability of the results. Also, 4 study samples outside the United States and 6 of the study had relatively small samples, indicated that those samples may not be representative of the population. Limitation of the literature focus on the use of limited databases for search in the systemic review, meta-analysis review, as well as methodological concern in experimental and quasi-experimental studies. Specifically, experimental quasi-experimental studies may not have been included blinding or through randomization. Gaps identified through literature search indicate that while mindfulness-based training for nurses can be effective, there is no consensus on what a specific program should be used to provide the training. Even in the systematic review evaluated, program content, duration, frequency were not evaluated to determine which mindfulness-based intervention was most effective. So the theoretical framework. For the purpose of this project, Roy adaptation model RAM was selected for use. Adaptation is the foundational concept involved in the theory. Roy believes that individuals were in constant interaction with the environment and therefore had to adapt in order to remain healthy. When patients cannot adapt to the environment, this leads to the need for medical and nursing care. Nursing care seeks to identify what factors are limiting adaptation and to address these issues as part of care to restore patient health. Under the model, the individual is conceptualized as having an internal and external environment that are in continually interaction and changing at the same time. As a result of the intersection of this environment, Roy posted that there were 4 modes of which individual could adapt, including physiological, growth function, self-confidence, and interdependence. Helping patients change in these modes can help to promote adaptation. Applying this information to my clinical topic to reduce stress among nurses using mindfulness-based stress reduction program, it was believed that by introducing this program to nurses, an effort was being made to help them to adapt to stress that they were experiencing as a result of their work. Methodology. On the following slide, there is a review of the methodology used for this project. So, in the current project, an effort was made to compare baseline perceived stress levels before and following the intervention. To compare perceived stress, a quantifiable measure was used. Because measurement and comparisons are integrated into the project, the methodology being used was quantitative. For the purpose of this project, a quasi-experimental framework was used. Quasi-experimental studies test and intervention, but often do not use randomization of the sample and or independent control group. This project used a single group drawn from a home health agency operating in South Florida. All staff with an active RA license were asked to participate in this study. This slide includes a review of the inclusion and exclusion criteria used for this project. As you can see in here, the inclusion criteria specify that all registered nurses, including those holding position as an RN and as band practice providers working at the practice site, were included, along with those working full-time or part-time. In addition to participating in the project, nurses have to have worked at the practice site at least 1 year and be between the ages of 18 to 64. Nurses were excluded from the project if they were under the age of 18 or over the age of 64, had been employed for less than 1 year at the agency, or if they were pregnant. So, data collection tool. The data collection tool used in this project included a demographic form and the perceived stress scale. The demographic survey created in this project includes 5 questions regarding the characteristics of participants. More specifically, the surveys assess age, gender, race, current position in the organization, number of years of employment at the facility. A screenshot of the perceived stress scale is provided on this slide. The instrument is widely validated tool for measuring stress and is available to open access. The instrument includes 10 questions that are scored on a 4-point Likert scale that range from 0, never, to 4, very often. A score can range from 0 to 40, with the higher score indicative of a higher level of stress. Cutoff value for a stress score as follows: 0 to 13, low stress; 14 to 26, moderate; 27 to 40 high stress. Data analysis. Data for this project was analyzed using the statistical package for social science, version 29. Specifically, descriptive statistics such as mean, median, standard deviation, and frequency percentage were used to analyze the demographic data as well as the pre- and post-intervention PSS score. Descriptive analysis of the PSS score was used to confirm the mean stress score before and following the intervention. Inferential statistics were used in this project to compare the pre- and post-intervention PSS score. Specifically, the statistical test used in this project was the Wilkinson sign rank test. Protection of human subject. Protection of human subject was addressed through this project. The project was initially approved by the Maryville University Institutional Review Board, IRB. Additional nurses who agreed to participate in the project signed a letter of informed consent, which outlined the rights within the study. All study data from the project was aggregated such that it was not possible to associate a single piece of data with participants. Further, all email communication with project participants used the blind carbon copy features to ensure that participants were not able to identify colleagues enrolled in the project. All the project data was stored on a password-protected laptop that was accessible only to the principal investigator. All individual project files were password protected as well. Results. On the following slides, there is an overview of the results obtained with this project, and here they are provided. Outcome of intervention, setting, and participant. The setting and participants for the project are reviewed on this slide. As previous note, participants for this project were recruited from a home health agency operating in South Florida. A home health agency was selected due to large nursing workflow, flexible work environment, willingness of nurses to participate in the project. Nurses with a registered nurse degrees or higher were recruited from the site. Initially, 34 nurses expressed interest in the project, accounting for 65% of the 52 nurses currently working in the practice. Once recruitment from the project was completed, 4 of the nurses chose to withdraw, citing time constraint. That left a total of 30 nurses who complete each phase of the project, for a total of 58 of the population. Data analysis, demographic data. Shown on this slide is a table that includes the demographic information of project participants. The summary of the data indicates that the majority of the nurses who participate in the project, 50%, were between the ages of 30 to 39. Further, the data indicate that most participants were female, about 80%, and identified as Latino, 70%. Further demographic data revealed that most participants were registered nurses, 87%, within the remaining nursing workers and as advanced practice nurses. Most of the project participants report being employed with the home health agency between 1 to 2 years, and that was around 53%. So, data analysis, PSS score. Data analysis for this project also include a statistical evaluation of the PSS score for the project participants. Initially, the pre- and post-intervention PSS score were evaluated based on a median score to establish if nurses' stress level increased, decreased, or remained the same 4 weeks following that intervention. The bar graphing here on this slide provides a comparison of pre- and post-intervention score. Mean score were known to be higher before the intervention, 33.0, and declining following the intervention, 20.5. Because higher score on the PSS are indicative of high level of stress, it's possible to see that the score declined 4 weeks following the intervention. Although the results do not indicate that there was a decline in the PSS score 4 weeks following the intervention, results from the descriptive analysis do not indicate if change in the PSS score was statistically significant or the value of the effect size for the intervention. To evaluate that statistical significance on the data, a Wilkinson sign test was used. The result of the Wilkinson sign rank test revealed that the perceived level of stress for nurses, as measured by the PSS, was significantly lower after the intervention, 20.50, compared to before. It was 33.00, with a C of -4.79 and a P less than 0.001. The tabulated effect size was an R of equal to 0.87, suggesting that the intervention had a large effect on reducing the perceived stress of nurses participating in the project. Discussion. The final slide in the presentation includes a discussion of the results and the conclusion that can be drawn from the project. So the results of this project indicate that 4 weeks following intervention, there was a decline in the stress score for nurses, and that effect size was large, So comparison of this result to the current literature regarding the use of mindfulness-based meditation to reduce stress does indicate that the findings are strongly alienated with what other scholars have noted regarding the effect of mindfulness-based meditation. Across various studies, scholars have found that mindfulness-based meditation can be effective not only for reducing nurse stress, but also reducing depression, anxiety, burnout, and for increasing job satisfaction. Although these outcomes were not measured in the current project, it is reasonable to assume that some of these benefits may have been achieved. So in here we have project strengths and limitations. Project strength and limitation are included on this slide. One of the greatest strengths of the project is that not only demonstrate a statistically significant reduction in stress following the educational intervention, but also the effect size was noted to be quite robust, 0.87. Large effect size are noted on the literature to be indicative of a research finding that has a practical significance. Another significant strength of this project is the number of nurses who voluntarily agree to participate in the educational intervention. Although sample size often vary, evidence indicates that in most research studies, investigators are only able to recruit 30 to 40% of the desired population on average. In this study, it was possible to recruit 58% of the population. Project limitations stem from the lack of generalizability in the findings through the use of a single site with a small sample size. Causality in the findings was also absent, making difficult to state with certainty that the intervention was the sole cause for stress reduction in nurses. Implications. The implication of the project for practice and future research and healthcare policy are noted on this slide. At the practice size, further research should include tracking outcomes for stress reduction over long term, while also mandating that all staff at the facility participate in training to reduce stress. The identification of patient care metrics that improve in light of lower nurse stress levels will also be important to consider. Facility policies regarding the use of mindfulness-based meditation should be drafted, along with policies to support the education of new hires to maintain stress reduction at the facility over a long term. Sustainability and dissemination. Sustainability of the project at the practice size will include the development of a team of periodically measured nurses' stress to determine what patient factors are impacted by nurse stress and to ensure that guidelines for mindfulness-based training are updated based on change in the evidence. Teamwork to achieve this outcome will be needed. Dissemination of the work will occur at the practice site and will include both an executive summary of the project result emailed to all staff and a poster presentation where staff can ask questions about the project. Externally, dissemination of the work will be slowed through publication and presentation at a national conference. The Journal of Holistic Nursing has included several articles on this topic in recent years, and the author guidelines for this journal do indicate that the editorial board does accept quality improvement project. A review of available conference for presenting the work does indicate that the 8th edition of Nursing World Conference is being held in Baltimore, Maryland, between October 17 to 19, 2024. The conference includes both poster and podium presentation and is open to all nurses who are seeking to showcase their work in advancing in nursing practice. So, conclusion. Although the results of this project cannot be generalized outside the practice size, when the results are combined with the current evidence on the topic, there is a formidable evidence base that can be used to begin the process of standardizing mindfulness-based meditation to help to reduce nurse stress and improve patient care. With this suggestion is that when this project was concluded, Having the benefit of mindfulness-based meditation for stress reduction over the long term will require continued effort, not only to maintain and improve the project at the practice site, but also to encourage other clinical sites to adopt the intervention and to work toward policy making at the states and federal levels. Before ending this presentation, I want to thank everyone to contribute to my ability to complete this project. It has been a challenging journey at times. However, I'm grateful to those who helped me to make this dream a reality. Here you can see my reference. Thank you so much.